So we go on to our next speaker, Dr. DEEPA, who is a very leading dermatologist and a cosmetologist from Coimbatore. And we would look forward to her inputs in this ocular aesthetic session. Dr. DEEPA, could you unmute yourself and get connected?
Yes, ma'am.
Yeah.
Yes, ma'am. Good evening. Good evening. I'm going to give you all a brief presentation about facial rejuvenation, a dermatologist's perspective. Facial rejuvenation is composed of a large group of cosmetic procedures, both surgical and non-surgical, designed to make facial skin and appearances look younger and refreshed. Facial rejuvenation is much needed nowadays because there are many.
Ma'am, your slides are not moving. Have you changed the slide? You're on which slide right now, ma'am?
She's on a second slide.
Second slide, ma'am.
Yeah, maybe you should keep clicking on each slide as you go down, or you go to slideshow.
She's on slideshow, but it's not showing.
Oh.
Same problem.
So you will have to click on each slide.
Yeah,
Yes.
now it's coming.
Oh, yeah.
Now it's come.
No, it hasn't gone to slideshow.
No, this is fine, ma'am. We can do it this way only, Dr.
Yeah, we can do this way, yes.
Shall I continue, ma'am?
Yes, yes.
Okay. Facial rejuvenation is composed of a large group of cosmetic procedures, both surgical and non-surgical, designed to make facial skin and appearances young and refreshed. Facial rejuvenation is much needed nowadays because there are many who try to recapture their youthful appearances, fighting the age game, and keep looking and feeling their very best as long as possible. There are social and psychological choices such as advertisement from print media, TV shows, and celebrity endorsement for beauty products and peer pressure, which influences people to look for facial rejuvenation treatment. Okay. There is a lot of demands for non-surgical procedures nowadays because it is minimally invasive with no downtime. It can be done even before an hour prior to any important occasions. Recovery is also very quick and cost-effective. Dermatological procedures that we do for facial rejuvenation is of two types. One is non-surgical and another is minimally invasive procedure. Non-surgical procedures are skincare regimens, chemical peels, microdermabrasion, and lasers. Minimally invasive procedures are microneedling, platelet-rich plasma treatment, Botox, fillers, and thread lift. Basic steps in any facial rejuvenation procedure is the selection of the good skincare regimen. This is useful in early signs of aging and to maintain the skin after rejuvenation procedures. We use products such as alpha hydroxy acids, retinoids, vitamin C, sunscreen, and peptides. Chemical peels are done by applying chemicals which causes inflammation, exfoliation, and destroys skin cells in a controlled manner. Indications are sun damage, wrinkles, acne, melasma, and scarring. Chemical peels are classified into superficial, medium, and deep peels depending upon the depth of the peels. Superficial peels are glycolic acid, salicylic acid, and gessner solution, 10% trichloroacetic acid. Medium peels are strong gessner solution, bisocinol, 15 to 20% trichloroacetic acid, low concentration phenol. Deep peels are phenol, 30% trichloroacetic acid. These are the before and after pictures of the patient who took chemical peel treatments for acne and melasma. There are visible results after 4 sittings. Microdermabrasion is a method of skin resurfacing involving mechanical exfoliation of upper layer of epidermis. It causes stimulation of epidermal cell turnover along with vasodilation, dermal edema, and collagen remodeling. To abrade the skin, we use aluminum oxide crystals and diamond tip. Laser treatments is of two types, non-ablative and ablative. In non-ablative laser, light energy is focused on the deeper skin. Among the non-ablative lasers, we use Q-switch NdOC for pigmentation and nevus and erbium glass NdOC for scars. The patient in the first picture is treated for pigmentation with Q-switch NdOC laser. The patient in the second picture is treated for nevus of ota with Q-switch NdOC laser. Ablative laser damages skin surface layer. We use fractional CO2 laser and erbium yak for scars and resurfacing. These are the before and after pictures of the patient who took laser treatment. We can see visible changes in the scars and skin texture. Microneedling is microneedling. In microneedling, the results are obtained by percutaneous collagen induction by mechanical trauma. We use derma roller and derma pen for microneedling. Compared to derma roller, derma pen has control over the depth of the needle. These are the pictures of the patient who has undergone microneedling. The results are convincing after 4 to 5 sittings of microneedling. PRP treatment is an autologous high concentration of platelets in a small volume of plasma. On activation, these platelets release various growth factors that helps in regeneration and restoration of human tissue. Indications of PRP are rejuvenation and scars. It is also called vampire facial. These are the pictures of the patient who has undergone PRP treatment. The results are visible after 5 sittings. As our speakers have already enriched us with all necessary information about Botox and fillers, I would like to move on to the next treatment, thread lift. Thread lift. The entire basis of thread lift technique is the cutaneous response to the presence of polydioxone thread within the skin. It is similar to the typical foreign body response of the skin. Types of PDO threads are monothread, twin threads, and cock hook threads. Indications are wrinkle, facelifts, stretch marks, cellulite, volume reduction, skin brightening, pore tightening, acne scars, facial asymmetry. The results are immediate and long-lasting. I would like to conclude my presentation by stating that facial rejuvenation is an existing field of art and science with an ever-expanding indications and procedure. Thank you.
Thank you very much, Dr. DEEPA, for your inputs.